Last week, Bernie Sanders proposed a bill that would accomplish his dream of single-payer health care. Now, in a Republican-controlled Senate, the bill doesn't have much of a chance, but it could have lasting effects on the Democratic Party. Talking Points contributor Dan Prager is here to explain why. Dan, thanks so much for being here.
It's great to be back. I'm excited.
So, Bernie Sanders obviously knows that there's no way that this bill passes. He's not going to get a single Republican vote on this. But what's his prerogative?
Well, this is kind of all part of Bernie Sanders' plan for his revolution. He is hoping, first off, run for president, show the Democratic Party that there are liberals out there, that there are people who want his agenda implemented. Step two is move the Democratic agenda further to the left. The Democrats in 2016 had a big problem in that they didn't really have any policy suggestions. They were kind of mostly running on the anti-Trump party, and if they did have those suggestions, they didn't communicate them well. This is Sanders' chance to say, this is what the Democrats stand for, and by putting it out this early, he's trying to make it so that this is what the Democrats have.
Now, identifying what the Democrats stand for, that won't have much play with a Republican-controlled House. So what does that mean for 2018 and 2020 moving forward to their sort of electoral identification?
Well, that's his big goal. He's obviously not going to flip any Republicans. No Republican anytime soon is going to say, oh, we need single payer. His goal is to take those House seats that are already Democratic and make them even more liberal. He's looking to primary Democrats and send out these more liberal people in 2018 so that the left moves left as the right moves right. And going past that, as he gets all of these people moving to the left, he's hoping that 2020 candidates, a lot of whom have said that this is a good bill. You think about Cory Booker, Kirsten Gillibrand, Liz Warren, Sanders himself. All of those people said they would vote for this bill as a symbolic gesture saying, all right, we're liberal enough, support us, and kind of take their base, galvanize them, and say, we're the people who will get this done.
And in 2018 and in 2020, I think the Democratic Party probably has to move beyond just being anti-Trump. They have to be clear about what their policies are. Do you think this is the type of issue that can galvanize voters and get people excited and going to the polls?
I think it really is. I think Democrats were looking for something. They do want more health care, and especially with a Republican push against it. The Democratic base, which didn't really turn out in 2016, is kind of galvanized with this. Obviously, the big risk is you're alienating moderates. But I think in this case, with the kind of push against healthcare and the popular support for it, moderates are more likely, some of them will leave the Democratic Party.
But with the push for the popularity of railing against healthcare, and there's still an opportunity for conservative senators such as Lindsey Graham and Bill Cassidy to kind of push through an anti-healthcare message. Do you think that that has any play moving forward?
I think the anti-healthcare message still definitely has play. Republicans are very against it. I don't think there's a Democratic senator or congressman who's going to vote for it. I think when we get to the point of a filibuster, there's going to be some big issues there. The Graham-Cassidy bill is an interesting thing in its own because it is a very moderate repeal of Obamacare. It's kind of Obamacare light, which is something that hasn't worked for them before. Rand Paul has already said he won't vote for it. So the Republicans are at about 51 votes now. They lose 2. They can't even push it through with a 50 majority. So I'm going to say there's not a great chance that it goes through. If by some miracle Graham and Cassidy are experienced enough to get that coalition together, there's a small chance, probably better than the other bills, but not much higher.
Single-payer health care may be a make-or-break issue for Democrats in 2018 and 2020.
Absolutely.
Dan, thanks so